Hey everyone, Dr. Shawhead here, and in this video, we'll be discussing post and cores. Let's get started with a brief review. A post and core procedure involves placing a post inside the root canal of a tooth that's undergone endodontic treatment. The post is essentially a metallic or fiber reinforced pin, and its purpose is to provide support for the core, which is the restorative material built up around the post to replace missing tooth structure and provide a stable base for the final crown. Now, one thing to note here, guys, is that posts are inherently bad for teeth. Structurally speaking, it's never a good idea to hollow out the root canal of a tooth to make space for something else. But in cases where we're trying to save teeth that have lost significant tooth structure, you kind of have to think about the post as a necessary evil, because without the post, the core doesn't have enough to grab onto, so it'll likely fail. You'll also want to consider the apical seal, which is another critical factor in the success of a post and core procedure. The apical seal just refers to the tight closure of the root canal at its most apical end with sealer and gutta perca. The seal prevents the infiltration of bacteria and oral fluids, which could lead to infection and failure of the endodontic treatment. In order to conserve the apical seal, 4 to 5 millimeters of gutta perca should be kept apically during post placement. So at this point, you may be thinking, okay, the core is retained by the post, but what retains the post itself? Well, I'll tell you. Post retention is determined by the length, width, and surface roughness of the post. That's right, some of you guys may have thought it's the cement, but cement actually has little to no effect on the retention of a post. And these three factors should make a whole lot of sense to you guys, because if you think about it, increasing any of these three factors will result in greater contact area between the post and the root canal, thereby increasing retention. So regarding length, you may wonder, how deep should a post extend into the canal? Well, the general rule is about 2/3 the length of the root. This will ensure that the post has enough tooth structure around it to adequately retain the core as it's subjected to various forces. Now, it's important to note that this length recommendation doesn't take precedence over the 4 to 5 millimeter of gutta perca we need at the apical end of the root. So sometimes with short roots, it's very hard to obtain this 2/3 length. Just something to keep in mind. And regarding post width or diameter, there's actually no specific dimensions to remember except that you just want an intimate fit, because without proper post diameter, there'll be no friction for mechanical retention of the post. The post would have way too much play or wiggle, and it will ultimately fail. And if you think cement would stop the wiggle, again, you would be wrong. Cement has little to no effect on the retention of a post. Alright, so I know that was a lot. Apical seal, dentin wall, post length, post width, post roughness, they're all important characteristics of a successful post and core. But to bring it full circle, I want to stress again, the most crucial factor for the success of a post and core is the amount of remaining natural tooth structure. And while it may seem intuitive for the post to strengthen roots and increase stability, this is actually not the case. Posts actually weaken roots and make them more prone to fracture. In fact, the most common clinical failures for posts and cores that you need to be aware of are loss of retention and root fractures. Alright guys, this is another great segue into a topic that I think is very misunderstood among dental students and even practicing dentists. It's none other than the Ferrule Effect. First of all, for some strange reason, everyone always thinks that the ferrule is referring to the remaining tooth structure, which is actually not the case. The ferrule is actually on the crown itself. It refers to the band of crown material that encircles the remaining tooth structure, shown here in yellow. So when the crown is seated, the ferrule, or the yellow areas on the crown, will give the remaining tooth structure a tight hug, helping keep everything together, and that hug is known as the Ferrule Effect. So why is the Ferrule Effect so crucial when planning post and cores? Well, first, let's consider forces, lateral and occlusal to be exact. If we didn't have the ferrule of the crown encircling natural tooth structure, you can imagine that any force that is experienced by the crown will be put directly onto the post and core, which is bad news. That's how we get fractures. By having the ferrule of the crown engage and encircle the remaining tooth structure, any force experienced by the crown will be transmitted to the rest of the tooth and PDL. This will also lead to significantly higher crown retention. And to maximize the benefits of the Ferrule Effect, it's recommended to have at least 1.5 to 2 millimeters of tooth structure above the crown margin. Alright guys, with all of that said, let's take a look at a potential error that can sometimes be seen with post and core treatment. In this radiograph, we have multiple posts, but I want to bring your guys' attention to the 2 posts on the right, where we see a space between the end of the post and the gutta perca from the root canal treatment. Typically, this happens either because of improper post space preparation or inadequate post length. Either way, this gap is a big concern because it has the potential to interfere with the apical seal of the root canal, which would then increase the risk for microleakage and infections. Now, truth be told, the gap seen in the middle post can also have been because of an improper impression. And you may be wondering, what do you mean by that impression? We're talking about posts that go deep into the root. This has nothing to do with impressions. But actually, depending on the type of post we use, an impression may be involved. Now, based on the radiograph, I can tell that the middle post is a cast post and core because of the irregular shape, whereas the post on the right is a prefabricated metal post, judging by the visible screw threads. And this segues into a great next topic of different post and core materials, and the options we have are prefabricated posts and cast posts. Let's start with the prefabs. These can be carbon fiber, fiberglass, or metal. The fiber posts are known for their flexibility and compatibility with tooth structure, and since they're prefabricated, they come in standard sizes and shapes that can be adjusted during placement. On the other hand, we have cast posts, which are custom made from materials like gold, titanium, or stainless steel. These posts are fabricated to fit the exact dimensions of the prepared canal, meaning an impression is necessary. Cast posts are known for their high strength, which is particularly beneficial in situations where the tooth needs significant reinforcement. Okay, I know that was a lot of information, guys, but let's now test our newly gained knowledge with some practice problems. Which of the following is most likely to lead to the success of a post? Post width, remaining natural tooth structure, post length, or post material? Pause the video if you need, but the answer is B, remaining natural tooth structure. I really tried hammering this one home, guys. Post width, length, and material are important, but none are as important as the amount of remaining natural tooth structure. Definitely remember that. Question 2. A patient presents with a root canal treated upper canine that is fractured at the gum line. What is the correct sequence for restoring the tooth? Again, pause the video, take as much time as you need, and the answer is C, endodontic retreatment, crown lengthening, post and core, and crown. The key here is that a fracture right at the gum line, guys, means that we have virtually no remaining height of natural tooth structure. And as you guys should know by now, that'll mean we will have no chance of achieving a Ferrule effect. So crown lengthening is a must. But typically, we'll want to retreat the root canal first since it's been compromised, followed by crown lengthening, then the post and core, and finally the crown itself. As always, here's a brief summary of some of the high yield points we discussed. Thanks for watching, and see you next time.